Okay, so my name is Dominika Kozak. I am a physical therapist in EGZOTech and a clinical specialist. My background is physiotherapy. I have obtained my PhD thesis, especially in the oncological field. I made a research about the post-cancer treatment patients, and I was observing the side effect of the sentinel lymph node biopsy among the patients with the conserving breast therapy treatment. So if you have any questions regarding the oncological treatment or the mastectomy and the breast cancer, so I am happy to answer all your questions. There will be the question and answer session after our webinar, so please try to pass the question in the question and answer session. So today we are going to talk about the oncological rehabilitation and how exactly the robotic device can be used for the therapy of patients with functional deficits as a result of cancer treatment, because we observed such effect. The most common functional disorders in the treatment of malignant neoplasms are limited joints mobility when this condition occurs, especially because of pain. There is always a post-operative scar. There might be the muscle weakness, limited physical activity because the patient is at the beginning immobilized in bed. Another one, muscle weakness or muscle atrophy. So here we think more about the cutting or removal of muscle. There are some conditions after the radiotherapy and after chemotherapy which might affect the muscles, and also some structural changes. Another one, muscle paralysis or even the paralysis. This is mainly caused by the damage to the nerve during the operation, during the surgery. The more the surgeon needs to look for the tumor inside the body, the more chances are to involve some nerves and to cut or to like distract the nerves. Sometimes muscle paralysis might be also a cause of caused because of large lymphedema. Last but of course not least, abnormal body posture. So here it's because of pain, muscle weakness, sometimes there are massive contractions, extensive scars, mostly after the irradiation process. Overload and degenerative changes in the joint of the limbs and spine. Here I think about pain, about muscle weakness, about contracture, about the scars. Lymphatic edema, very, very common. It's mostly observed after the removal of lymph nodes of the region near the tumor. So for the breast cancer, it's the axillary lymph node removal. Sometimes lymphoedema is caused by the by irradiation. Another side effect, another functional disorder is impairment of lung ventilation. So here we are talking about the removal of lung tissue, limitation of physical fitness. It's of course secondary functional and structural changes in the muscle. Patients are limited in the everyday physical activity. They are limited in moving around, so they are mostly immobilized in bed. Decreased performance, fatigue, of course, it's caused by the oncological process. So sometimes it's after anemia, after the radiotherapy, after the chemo. Imbalance and coordination disorders, it is after radiotherapy, after chemotherapy, and sometimes also this side effect occurs among patients who have undergone the therapy of the brain tumor. Oh, I'm sorry. Surgery and adjuvant treatment of breast cancer can lead to adverse consequences effect. And here we think more about the applied forms of surgical treatment, which really depends on the stage of the disease. And the procedure, like the surgery of the breast cancer treatment, mostly affect the functional efficiency of the upper limb. Mostly it goes together with the operated side. We can observe a lot of changes in the body posture, and also there are a lot of changes in the mental functioning of the patient. How about the body posture? Because of removal of the breast, we can also observe the spine deterioration. So the patient is developing the scoliosis, and also it is mostly associated with a lot of spine pain. What are the common problems which we can observe after the breast cancer therapy? First of all, it is the restriction of mobility in the joints of the shoulder. And we can also see the side effect depends on the completeness of the procedure. So whether it was the total removal, so the total mastectomy, or just the lymph node was removed, or just the tumor. In patients who underwent the surgery, the mobility of the shoulder is very limited. And there are several factors which contribute to the occurrence of this upper limb impairment. And these factors include the post-operative pain, the location of post-operative scars, of course, weakness of the muscle groups in the shoulder. Sometimes we can observe the changes in soft tissues, which are, of course, related with the healing process. Also, shoulder is many times affected by the analgesic positioning the limb on the operated side, and the patient is lying on the operation table like for 5 hours sometimes in this arm abduction position, so it might also affect the shoulder. And the greatest limitation in the movement we can observe in the horizontal extension, abduction, internal and external rotation on the shoulder. Some muscle weakening we can also observe in the group of adductors and external rotators, and also in the group of muscle which are responsible for horizontal flexion of the arm. Robotic technology is really gaining a lot of importance in the field of rehabilitation. A lot of different robotic types devices is used to treat upper limb. Why is that? One of the factors determining the return to everyday life is the improvement in the motor control of the upper limb, because this improvement may increase the ability to perform everyday activities. There are some studies which emphasize the clinical importance of robotic-based rehabilitation. This kind of rehabilitation is very beneficial for being able to program direct movement patterns, which includes the functional movements, and these functional movements allows the patient to train the impaired function. Here I would like to emphasize using the devices that use the reactive electromyography, so that's the Luna has it implemented. And here we can choose the specific muscle to work on it, and this muscle activates the robot's extension through the EMG, which in turn assists in the movement. Of course, there is a big role of the devices which use the biofeedback, and they should actually provide an accurate analysis of the patient's data. And this data can be also stored. And the study shows that it is highly recommended to use robotic technologies as a complement to the holistic therapeutic process of patients who undergo the rehabilitation. Therapeutic intervention using biofeedback in breast cancer rehabilitation need to provide some personalized feedback. That responds to changes in the neuromuscular system. And here rehabilitation robots meet these criteria due to the fact that each exercise is really exactly matched to the patient's abilities, because here we can do the EMG calibration before implementing the exercise, and we can assess the patient for the exercise parameters. We can also progressively change the parameters as soon as the improvement is achieved. So thanks to this, the biofeedback, for example, used in Lun EMG, is always adapted to the patient's needs and to the patient's abilities, and the feedback directly corresponds to the changes that occur in the movement. The use of rehabilitation robots in rehabilitation of patients after mastectomy, so here we focus more on the breast cancer, allows really to work both on the structural level. So here we can improve the range of motion, the muscle strength, the coordination, and we can also work together within the functions, which are very important for the everyday muscle activity. By using the robotic technologies, the everyday rehabilitation process can be very, very directly monitored and tested. All the reports are really stored in the patient's profile, and we can also repeat the exercise, which is really motivated for the patients. I would like to skip more and focus on different kind of cancer treatments. So about the lung cancer, what is recommended after the surgery? The recommendations follow like the breathing exercises, active exercises for both upper and lower limbs, which are performed symmetrically, passive and self-assisted exercises. Sometimes the exercises are more conducted by the therapist, so more passive movement. And here I would like to emphasize the rehabilitation robots, which are really enabling both working with the large muscle groups, so we can focus more on the trunk, and we can focus on strengthening the muscle corset. And here robotic devices give the possibility to assist during the movement. Rehabilitation with the use of the robotic can be implemented in patients who suffer less pain or with some reduced muscle force. And here, in order to eliminate the exercise, the excessive muscle tension, which very often occurs in the area of shoulder and in the trunk, we can use the EMG biofeedback that really allows us to observe the muscle tension and also to work with the patients on the active relaxation, because this is commonly the problem. Soft tissue neoplasms, or so more about the sarcoma. Here rehabilitation begins before the surgery. We need to implement the rehabilitation as soon as possible after the surgery. And the biggest goal is to achieve the best possible physical fitness and the limb function. According to the studies, the current standard of care for patients with soft tissue cancer is limb salvage and adjuvant therapy. In this type of cancer, the survival rate is approximately 70%. Extensive surgical restriction and subsequent reconstruction result in chronic disability in about 50% of people suffering from this kind of tumor. And rehabilitation is designed mostly to optimize the functional independence of those patients and to improve the quality of life. And mostly it's implemented for those patients who undergone the surgery. The biggest role of the rehabilitation robots here is to support the rehabilitation process in regaining the limb function. And here we can use the passive movement, the assisted activated by the EMG movement, and also the resistance exercises. Few words about the bone cancer. Here the combined therapy, so chemotherapy, radiotherapy, and the surgery results really in a complete change on the strategy in treatment of this group of patients. And here the use of pre-operative chemotherapy usually causes the tumor regression, and we can observe the reduction of the tumor mass, which enables the surgeon to go with the less destructive surgery, but still the surgery is really radical. The rehabilitation procedure in this kind of tumors is focusing on regaining lost functions, which are lost due to the surgery. And in this case, robotic devices is using this kind of devices is a particular benefit because the therapy can start relatively early. We can start the training with isometric exercises, also with the use of the EMG. We can increase the range of motion. We can work on strengthening the muscles. We can use the robot-assisted exercise and also various types of the resistance. Another type of cancer is melanoma. So here the rehabilitation of patients who have undergone the surgery mostly to remove the lymph nodes is very important. And those patients often have the failure of the lymphatic system. We can observe the fibrosis. We can observe a lot of scar tissues in the operated area. And here physiotherapy is used mostly to regain physical fitness and the use of exercises mostly based on dynamic muscle work. We are working involving rhythmic muscle contractions and relaxations. So we are using mostly the pump, the muscle and the blood vessel pumps. And this creates the most favorable conditions for influencing the blood and the lymph vessels. And here we can also improve the range of motion and increase the muscle mass. These therapeutic goals can be also achieved by using, of course, the innovative devices. So training with, for example, Lun EMG will enable the patients to work on increased range of motion and to improve the muscle strength. The use of innovative devices in oncological rehabilitation not only enables the achievement of our therapeutic goals, also by using the assistive technology, we can relieve the medical staff. So this enables us to treat two patients in the same time. Lun EMG is a rehabilitation and diagnostic robot for the professional therapy of patients with functional deficits, which are results of cancer treatment, especially in the upper and lower limbs and also in trunk. How does Lun EMG actually work? So in the brain, brain develops the intention to move. And EMG sensors, which are attached to the patient's body, capture the voluntary muscle activity. So it's more about the EMG signal. And by this signal, based on this signal, Lun EMG responds to the user desire to move and provides the assistive movement based on the real-time EMG. And on the screen, patient see the feedback of the muscle activation, and this enhances the brain plasticity and allows the biofeedback-based motor learning. The common indications of using Lun EMG with oncological patients are post-surgical conditions, the states after chemo and radiotherapy, prolonged immobilization in bed due to some side effects or muscle weakness or anemia. Of course, we can use it after mastectomy with the shoulder rehabilitation. We can use Luna also with neuropathy as a result of chemotherapy, with neurological deficits due to the treatment of the brain tumors. The brain tumors we mostly treat like the stroke. The symptoms and the side effects, the functional deficits are really almost the same like after the stroke. So, oh, I'm sorry. Exercises with the use of rehabilitation robots support the process of physiotherapy in oncological patients with functional limitations. And here we can use passive motion, and Lun EMG enables more effective work with the patients on limited mobility in joints, treatment of tumors located in joints. Here we can observe the extensive scars, the radiotherapy in these areas, and also we can apply Lun EMG by using passive motion after the mastectomy in the first period of rehabilitation treatment. Further, through the assistive movement triggered by EMG, Luna enables to work with patients with muscle weakness, muscle atrophy, also with the patients who suffer with muscle paralysis or complete paralysis. And this kind of therapy is recommended on every stage of the disease and any stage of the treatment. In oncological rehabilitation, it is also possible to use the resistance exercises, but we need to remember that the intensity should not exceed 70% of the maximum resistance which is possible for the patients. And the exercises will only be effective if they are performed systematically. So everyday rehabilitation, even shorter, but doing it systematically with the right frequency and for a specified period of time. So the recommendations are to exercise 3 to 5 times a week for 30 to 60 minutes, and this type of training should be conducted for at least 6 weeks. Using electromyography, which is implemented in Lun EMG, can also be used for the body correction and for the correction of the body posture. And we can also work on improving the muscle coordination. Robotic assistance will also be very useful and desirable in patients with reduced efficiency and increased fatigue. So here, when we go with robotic assistive programs, we can take some load from the patient, but in the same time, the patient is working actively. So Lun EMG, just to conclude, gives the possibility to perform robotized passive exercises, strength training, exercises with the resistance. We can also involve patients and make him more willing to undergo the rehabilitation by using the rehabilitation games. We can also work on some flaccid muscles and spasticity paresis by using the reactive electromyography. And Lun EMG can be also the assessment tool. And here we can assess the muscle strength before and during the therapy. We can assess the proprioception, which is very important for the shoulder treatment, for example, or for the patients after the brain tumors. And we can also assess the range of motion to work more on increasing the range of motion. In Poland, we have already equipped 12 different oncological hospitals with Lun EMG devices, and so Lun EMG works in 12 different hospitals around Poland, working with the oncological patients. And we can also share with you good references from the oncological center in Bydgoszcz. It's the central Poland. And here Lun EMG very well fitted the needs of a daily work with patients suffering from oncological treatments in this hospital. Patients with soft tissue neoplasm work more effectively to stimulate the disrupted kinematic chains. People with after the brain tumor surgery are more willing to perform the task on Lun EMG. Also, they tried Lun EMG, they work with Lun EMG in patients after the mastectomy. So here the robots are the tool to determine the active and passive range of motion of the shoulder joint. And also by using electromyography, they conduct effective training in male patients after prostate surgery and female patients after long-term treatment of endometrial cancer. And here they work more with the pelvic floor and with the internal electrodes. Okay, so for now, I would like to thank you for your attention, and I would like to hear your comments, and if you have any questions, I am happy to answer. I see one question already. Okay, so the first question: can the same therapy used for post-surgery lung cancer patients on Lun EMG also be applied to COVID-19 patients? Yes, this is a very similar case. We can work on the muscles around the chest, and also the patient's condition is more or less the same. We can treat this kind of patients like the post-surgery lung cancer, or depending on the stage and depending on the patient's condition, we can work also by using the bedside therapy treatment possibilities with Luna, which I was talking about during the last webinar. Oh, do you have any more questions? How Luna EMG correct body posture for post-operative patients? So here it's more about the therapist. By using EMG, we can apply the EMG on different body parts, and for example on the spine. and on the shoulder and on the scapular region. So here we can ask the patient to work and to contract actively the posture muscles. So here I would work mostly on the EMG, but also with the patients after the mastectomy, we can work with the shoulder girdle and the shoulder joint. So here also active work on proper positioning of the shoulder after the mastectomy, because they have mostly lowering or make it the shoulder higher. It also works on the body posture correction. Is Lun EMG also effective for improving numbness due to chemotherapy? This numbness after chemotherapy can be also treated. We can try to apply Luna EMG mostly with the EMG. So we can work with the EMG and we can work with the proprioception. And by using the proprioception program, we can also improve the numbness. How it is used for determining muscle strength or proprioception. The muscle strength we can apply, we can start with, of course, the resistive programs. So depending on the patient conditions and the possibilities, we can start with elastic resistance with the weightlifting and adjust the weight, the resistance according to the patient's abilities. We can also work with proprioception by using the special designed the proprioception program and proprioception training to make the patient feel better the limb positioning. Another question here. What specific kinds of exercises can Luna EMG apply to breathing difficulty? Here I would more say about using the EMG biofeedback and to work mostly with active inhale and exhale and the muscle activation and relaxation. And also we can apply EMG on the belly, and we can work more on the breathing. So if the patient is going to breathe more in the chest or more in the abdominal area. Sure, the recording of this webinar will be available for you and will be sent via email afterwards. If there are any more questions. Okay, so if there are no more questions, so I would like to thank you for attending this webinar. I hope you gain a little bit more knowledge about Luna EMG in oncology, and you need to remember that Luna EMG is safe and can be implemented for the oncological, post-oncological treatment patients. So it's very, very useful. Thank you for your time. Thank you for attending this webinar, and hope to see you next time soon. Thank you. Bye-bye.